Let's take you back to KwaZulu-Natal, where Health Minister Dr Joe Phaahla and his deputy Sibongiseni Dhlomo, as well as KZN Health MEC Nomagugu Simelane, are conducting a site visit at facilities affected by the recent floods. Last night, President Ramaphosa announced that mobile clinics will be erected in areas where infrastructure has been destroyed to ensure that patients are still able to access their chronic medication. Newzroom Afrika's Ziyanda Ngcobo is at the Prince Mshiyeni Memorial Hospital in Umlazi, and which is the starting point. And let's listen into what the MEC and the minister is speaking to.
There's no immediate promise with the actual pipes can be connected.
Well, Mpo, I can tell you that there has been an issue with water here at the Prince Mshiyeni Hospital. So at the moment, the conversation is about how the KZN government can boost this reservoir, which seems to be under pressure. And so let's listen into what she has to say.
Was to say they will provide us with the tankers for our reservoir wherever we want the reservoir to be filled, because they have to prioritize communities as well. This community in itself, Umlazi, is also struggling with the water, so almost all of them don't have amanzi. So while they acknowledge and appreciate our challenge, I don't think we are really number one in the bigger scheme of things, because really communities are struggling. We appreciated that because for as long as they can give us some water tanks and we fill our reservoirs, and then I think we'll be fine. We'll be able to run the hospital. The problem is when we don't even have access to the water tanks. That's when the crisis comes.
So there's an undertaking that the system can put water inside the reservoir will work sometime today.
Yes, they said they're going to work around the clock. We hope that probably by 8 o'clock tonight they must have finished, and first thing tomorrow morning we should have our water tankers filling up our reservoirs.
Because you can't sustain, because it's a paradox where, because of the backlog of last week, you have thousands of people who are coming for service, and then you don't have enough water. It's a recipe for serious risk. Just the infection control and, all the services. X-rays. How do you run the X-ray when you don't have running water? X-ray also need, do they also not need, theaters, X-rays, everything.
Water cleaning,
Yes. Water cleaning.
Serious problem, especially like in the food service division, because most of our pods use the steam to cook for patients. So for now, we have a contingency of using our electric pan and pods, who are very minimal to try and cover the patients. And when it comes to the canteen, we have stopped it, and the residents are not getting the meals because we have to provide for the patients, especially. Yeah.
Okay.
Health Minister, if you could, you're live on Newzroom Afrika, and I'm glad you've got the MEC with you and your deputy. I've spoken to a doctor who works in the theatre in this hospital, and they've told me that it's been 4 to 6 days without water here, and they're concerned about patients, for instance, who have abscesses, I think, and that it could get bigger and they could ultimately lose their limbs. But they were even talking about how their toilets, they're just filled with just feces and whatnot. You can just imagine the situation of not having water. The question really is, why were hospitals not prioritized when it comes to water, especially this hospital, Prince Mshiyeni, which takes on huge numbers from several areas? Perhaps also MEC, you could jump in there.
Well, I think the MEC has explained that it's not that the hospital has not been prioritized. The hospital has been prioritized. It's just in terms of the nature of the infrastructure. That's why what was found was that because this reservoirs, as the team have explained, it's actually your contingency. It's like your generator when the power goes off. So normally this can take care of, your normal water interruption of 2 days. Now, so because this water will be stored here, then it did happen. They managed to survive for 4 days, from the 11th to the 14th. But the problem now is it's not meant to, as it is now, to push water from a water tank into the reservoir. it's not meant that way, is to store water from the pipe. Now the hospital is being supplied with the tankers. But as you have said, it can't flush toilets. I mean, you've got to carry the water into each. It can't work. It can't operate steam to sterilize instruments for theater and a lot of things, as they have said. So that's why, even though I think we must commend the team led by the MEC for the fact that they are able to provide some basic service, at risk as it is, because it means, the sooner we can get closer to some normal flow of water. And that's why we are encouraged that if what they are doing now to adjust this reservoir such that it can take water from outside, because now it receives only water from the pipelines. And now the pipelines are not functioning. So now they are adjusting it to receive water inside from a tank, from a water tank. But I mean, to fill in, because you also need some pressure from inside. So that's why they're talking about at least 20 to fill in, because you must have volume enough. And then, as they are explaining here, this will also put pressure. It will, from the pump here, it will be able, at least once the water is there, they will be able to pump. So if everything goes according to the plan, as the gentleman was explaining, if this is done by late today, hopefully by tomorrow morning, with many tankers filling in here, they will be able to start flushing, which will really take us a long way if they can put the water and the water starts to flow into the system of the hospital.
Minister, maybe I should ask this to MEC Simelane. Is there provision that's been made for those who would have urgently needed assistance, medical assistance that needs water, to be moved to other facilities? So there are elective surgeries which I believe have been halted for now, but there are other more urgent procedures that many would have needed to do, and in order to prevent their medical condition not deteriorating, perhaps moving them to other facilities would have been an option?
Thank you very much, Ziyanda. Fortunately, in eThekwini, we have quite a number of regional hospitals, and we are able to work together, not just the regional hospitals, the other tertiary and central hospitals who work as a complex. So yes, it's not even an option. It's what we actually began to do about 2 or 3 days ago. When we realized that we couldn't get the supply as we needed, we started moving some of the procedures that needed to be done to King Edward, and some have been moved to Nkosi Albert so that they are able to be attended to. You asked a question earlier on why hospitals were not prioritized. Indeed, as Minister indicates, they were prioritized, but as you will remember, we actually could not even access Umlazi about 2 or 3 days ago. So even when we did get the tankers on the 12th, on the 13th, they couldn't actually get into the vicinity. And area or hospitals like Wentworth and Mahatma Gandhi, which also had challenges of water, were able to get water, the tankers, because the road was actually drivable. But here, Umlazi in particular, it was that particular challenge. But now that we have a road, we have access, and there's an alternative route that has been created by the municipality, it's why yesterday we were able to get our tankers in. As the minister indicates, yesterday the team came and they were trying to provide the water, but we discovered that our outlet is not compatible, or there's no outlet that is compatible with the tankers. Now the team today is working on putting a huge JoJo tank that will put the water, have a pump that will pump water into the reservoirs, and if we get about 40 water tankers, that we believe will assist us for the next couple of days, and we allow the water tankers to go and assist other communities, and in about 3 days or so, if the water is not restored, then they will come back and give us another 40 or so liters. As you can see, that the reservoirs are quite big. One is about 1 million liters, and that is a huge number if you are going to be filling it with water tanks. But we do appreciate the fact that we've had quite a number of donors. We've got our own tankers as a department in the province. They are not enough. Each facility only has one. ABSA has donated about 20 or so, and they are willing to bring, and we are calling on other people who are willing to donate their water tankers to actually make sure that they give us those tankers so that we are able to fill these reservoirs as soon as possible.
MEC, we know that the health system system, not just in KwaZulu-Natal, is under a lot of strain, but I'm sure as a result of the floods, this has been exacerbated. In terms of the state of healthcare workers, are you at a stage where you are going to need reinforcement from other provinces?
At this point, we were going to have a lot of pressure in relation to the forensic pathology, and we have been able to get a reinforcement